Yes, and thank you, Peter, and thanks to the panel. The session today, Victor, has really been extraordinary, and it's entirely appropriate, I think, as we turn our sights after the break and after we hear from Victor Dzau to applying models of care to diverse circumstances, that we welcome the President of the National Academy of Medicine, the first President of the National Academy of Medicine. Yes. And in welcoming Victor Dzau, I should say that just as I mentioned this morning, this meeting with its focus on advancing the frontiers of medicine, of science, social policy, and partnerships across the board is an ideal meeting to launch the National Academy of Medicine's series of meetings into the indefinite future. It's also especially appropriate that it be the inaugural meeting for Victor Dzau, because Victor, now 6 days the president of the National Academy of Medicine, has devoted his career in many ways, but I think two are very important to underscore and especially prominent. One is his scientific and medical leadership to improve care for complex diseases. And the second is his similarly strong commitment to and leadership for mobilizing community resources to reach out to and engage the least served of our population. So Victor, it's a great pleasure for me to welcome you and thank you for joining us.
Thank you. Why don't you turn that slide off now? No. Good. Wow, sounds pretty good. My inaugural meeting, 6 days as president of the National Academy of Medicine. But as you know, we are really, we descended from IOM, let's not forget it. And I've been in my job for exactly 1 year. And I have to say it's been an exhilarating year. Very busy, lots of things happening, but we're glad where we are today. Because to me, I call it not renaming, the reconstitution of IOM to the National Academy of Medicine is a very exciting and well-recognized step for our field. After all, 45 years since the founding of IOM, it was founded as an institute within the National Academy of Science. And today, we can proudly say we are an academy. We've functioned like one for many years, but we have now the official status of academy. And the constitution has been changed, and that's why I use the word reconstitution, for National Academy of Science, now to in fact have 3 academies under the same roof. And you know, so it's important mainly because I simply believe that health, medicine, the sciences, health sciences, have reached such an important part of everyday life and have such great impact and the great distinction and the quality that we carry, that it's only fitting that we have this recognition. So congratulations to all of you who are working with us, who are members of NAM. I think this is a very exciting future for all of us. But we're not forgetting our roots. Institute of Medicine is our roots, and we continue to recognize its roots and the importance of recognizing what's done. And oh, wonder who's calling me right now. Let me just take this off first. Yeah. Anyway, so I do want to first say something that's important. I think that many of you just read the nomination of Ralph Cistron's successor, Masha McKnight. I think it's an outstanding appointment. And about time that we have women at the helm and diversity. I've always been worried that we have 3 white men, I'm not white, or 3 gray-haired men at the leading of the National Academy, And in fact, the average age is a little bit on the older side. So it's really great to have, now National Academy of Science, if her nomination goes through, led by a woman who's highly distinguished and also a little bit younger side. So this is all very good news for the academies. So in the formation of National Academy of Medicine, it's really part of a larger internal reorganization that many of you may or may not know, which is what I'm here to explain to you. What does this all mean? What does it mean to our programs? What does it mean to this very important, now called Leadership Consortium? And how are we going to move forward? I'd like to spend a few minutes talking about that. So part of the conversation that started this whole idea of having National Academy of Medicine is because there are many people sense that IOM should be an academy. But for many years, actually, the academy is structured in such a way that IOM is a little different from all the others. It is, as many of you read, is a health arm of the National Academy of Sciences. So we're not an academy. And if you can find, I think, whatever order slides, you want to put that on and go backwards, go forward. Yes, here. So pre-July, this is what the academies look like. Actually, IOM, if you can draw a line from the academy side to program side, is on the side, whereas NAS, NAE works through an operating arm called the National Research Council, frequently confused as the Nuclear Regulatory Commission, that actually runs all the programs through divisions. So in other words, my counterpart, the presence of NAE and NAS, do not directly get involved with the programs. They do, but they don't so much, but they have an NRC in between. NRC has 5 divisions that has Earth and Life Sciences, Engineering, Physical Sciences, Policy and Administration, Behavioral and Education, Sciences and Education, Gulf Research, and Transportation Research Board. And so they run it through a process which IOM actually totally follow. In other words, the rigor by which we do our reports, the rigor by which we select our members, the review of the reports all follow NRC, except we're more vertically integrated versus the others having an intermediate structure. Next slide. What's happened is, this is what now has happened. In other words, as of post-July, we're now more integrated. So part of the drive for the other academies to vote for us to become an academy is not only because they finally believe we deserve it, and of course we do, but also because they feel there's a chance to better integrate health sciences into the national academies. It's always seen that health sciences people in IOM talk to health sciences people. Engineers said we have so much to offer. Behavioral science said we have so much to offer. Why don't we all kind of bring things together in a more multidisciplinary way? So part of the renaming is also internal organization that looks like this, which is now we have 3 academies overseeing NRC that runs 6 divisions, of which health is one such division, retaining the name IOM, and I'll come back to that in a few minutes. Next slide. Okay, so go back to the slide before. So NRC now is going to disappear now from the public. You're going to not see NRC. In fact, what we've decided to do is to call this the National Academies of Sciences, Engineering, and Medicine. So the clarity out of this is that when you go outside, you can say, we're part of the National Academies of Science, Engineering, Medicine. 3 academies in one that runs these programs from engineering, physical sciences to healthcare. And so if you were talking about IOM, I would say IOM is a division of the National Academy of Sciences, Engineering, Medicine. To me, that still links us closely to the medicine piece, but it expands us the possibility of having other disciplines more working collaborative along with us. So far, so good? Okay. So that's the concept behind this. And I need to clean up the slide a little bit. I just quickly pulled some together. But I think what one of the slides would say is rather than call it NRC, it's called Programs of National Academy of Science and Engineering Medicine. Now, one of the really important issues, of course, all of us recognize is the brand of IOM. We're proud of it. I'm proud of it. And so, as Mike would tell you, we fought so hard to retain that brand. Because one idea would be, let's call the divisions all divisions and just kind of what I call homogenize it. Division of Health is IOM, Division of Physical Engineering Sciences, and so on and so forth. And so we work very hard, and I give credit to everybody in this room and our staff, and because the External Review Committee that points out how important the name IOM is. So with that kind of work that we did, some branding exercise, we actually went to the Hill, to the agencies, and people all say, oh yeah, IOM is a big name. We don't want to lose that. So we convinced the decision makers, that is, as you can imagine, we are 3 academies, so a lot of people make decisions together, to retain the IOM name for 1 year, which simply means that we have a low chance to say, don't lose the brand, but let's take a look, think through this, what does that mean? I want to point out to you, for example, TRB. How many people know what TRB is? Yeah, this is a Transportation Research Board. It administers how many hundreds of millions of dollars? 400, maybe more? All of the transportation research dollars in this country is administered through TRB, okay? So it's a kind of big name, and it's not about to change it to a division or whatever. So we're using this argument to contain IOM. Your question for me would be, what does that mean to the Academy of Medicine and the IOM, the program? Well, so we worked really hard again to negotiate to get it right. So the good news is that each division has a committee that oversees it. And so IOM will have a committee. And we've been able to manage to have 50% of IOM committee being from the National Academy of Medicine Council, which is basically IOM, the son of IOM. So therefore, we have maintained a majority of presence of IOM on the committee, with the addition of 3 members. So that's it's a 16-member plus the chair. I'm the chair, so there's 17 members. So 8 from IOM, 3 for National Academy of Sciences. All of them, in fact, are also IOM members, and 3 from National Academy of Engineering, 2 of whom are IOM members as well, and then 2 non-members who are really more public or people who are very knowledgeable who are not in the health sciences area or non-members. So actually, I think it's going to make this committee very interesting, a little bit more better mix. Second thing is, I'm the first chair of that division. So as president of NAM and chair of the IOM, we will maintain that continuity. And we'll maintain the same process. I'll sit through all the report briefings, report release, internal briefings. We maintain all those activities. And so I think to a large extent, one shouldn't see a huge difference except for the organizational structure that we have I've shown you on this table. Next slide. So here's what the National Academy of Medicine org chart looks like. I'm the president, and now the Home and Foreign Secretary are now as elected officers. This is on par with the other academies. And as you know, Jane Henney and also Peggy Hamburg. You guys see something interesting there? Both Jane Henney and Peggy Hamburg are not only women, but they were both previous FDA commissioners. So I wonder, what did I do? I must need some regulatory people around me. Clyde will remain as the interim executive officer, and he also would be, as you see, executive director of IOM, so that's another set of continuity. And then we're gonna have to build our entire academy infrastructure from finance, administration, because it's now integrated in IOM. So IOM will have its own administration and finances overseeing the programs. The academy will need its own finance administration, council membership services, development, and communications. We built our own new communication shop. Now, important to you here are the programs of NAM. NAM is not going to try to do consensus studies, which is what IOM does. It's not going to do a lot of the things that IOM does. However, it will have 3 major programs, and we're very, very pleased to have the Leadership Consortium program with Mike McGuinness as one of the programs, because it's always been unique. It's always been bringing people together to talk about what's the future of healthcare, what's the science value. So Mike has joined the Academy side. Maria Michnik's program and Health Policy Fellowship, the Robert Wood Johnson Clinical Scholar, many others, will come, of course, appropriate to Academy. And then we started a new initiative called Innovation to Incubation. It's my own feeling that, as what Mike has shown, and many of you working with Mike have shown, that we have many good ideas and many great reports, but frequently after the report's done or ideas is discussed, we don't do implementation. And it's written that we shouldn't do implementation. However, my feeling is we can do incubation. In other words, you've got a good idea, let's not give it up. Let's just keep it within National Academy of Medicine and bring it as fast as we possibly can to implementation. So we're going to spend a lot of time thinking about what are new innovative ideas, what are impactful ideas, and how do you take great ideas that people get together to create new entity that can make implementation. One example is Pete'sNet, which came out from, in fact, your roundtable, right? That people got together and say, we need an organization that brings together clinical trials in pediatric population. And out of this is created a new entity, which is a 501c3, right, which organizes. So we like to do a lot more of that. We'll maintain the awards symposium, and importantly, we'll have the publication. Perspective will now reside in National Academy of Medicine and not in IOM, although IOM can generate perspective, but they will be actually through our office, through as a publication of National Academy of Medicine. So that's going to be quite important. As you imagine, many of the things that you do, in fact, will be published through the perspective in the National Academy. Now, at the bottom, you see a list of very exciting initiatives, which are not programmed yet, but they are well along the way, and when they fully reach fruition, they could become our new programs. They include the culture of health. Many of you will soon hear, because I guess we already signed the deal with Robert Wood Johnson for a $20 million agreement over the next 10 years to actually do culture of health with them. And of course, Healthy America, many of you heard Harvey Feinberg's initiative with PGB about bringing a lot of education and branding on health to the community. I want to point out 2 things at the bottom, these things at the bottom. Global Health Risk Framework. This is a big initiative that we started on the pandemic responsiveness after Ebola. We're now well into a deep study into the future globally. We have a commission by which we will have a report for UN, for WHO, and for G7 about what the world must do about financing, governance, health system, and R&D. So this is a good example of our relationship between NAM and IOM, because this idea came from the Academy side, and of course, to implement this, we have to mobilize all of the staff of IOM. The one on vital direction of health and healthcare is another one. With Mike McGuinness' help and Clyde Binney, we have started working on the steering committee, which Mark McClellan co-chairs with me, and we are now getting ready for advice and to inform the next US government administration about the future, next step in healthcare. So we've got an outstanding steering committee with Tom Dashiell and Bill Frist and Mike Levitt and many other notables, and we are going to work on this with a series of perspectives meetings, which will tee up for the next US administration. And so you can see that the National Academy is going to take on a lot of these very exciting things, which I would call the most important issues that we should take on that's pressing. What's different in IOM and NNM is that we're going to drive this kind of thinking, but when it comes to consensus study and deep dive, the staff of IOM would take over. So that's a nice link between NAM and IOM and not disconnecting the two. Next slide. This is what IOM would look like. We have now the 3 Academy presidents. We have the National Academy of Science, Engineering, and Medicine. Underneath this is Institute of Medicine, which Clyde Binney will be Executive Director, Continuity, and I'm the Division Chair, Continuity. And as you can see, the divisions, which are the boards which existed previously, will continue, with the exception of Children, Youth, and Family that's co-shared with, in fact, the Division of Behavioral and Social Sciences and Education. And otherwise, you can see IOM will continue the same structure. Next slide. Okay, let's go to the first one. So far, is that fairly clear? This is my first time publicly telling people, so it's important for me to know where you stand and whether this is fairly clear. I know that even in our own internally, it's sometimes a little confusing because it's moving a lot of deck chairs all over the place. But I would say the following. One is we believe in continuity, and it's not a separation of, severance between NAM and IOM. Many of us will continue to work the same way. Secondly, we believe in more innovation, more impact, more leadership, and I think NAM is going to help us move there with your help. And so if you look at what's in which part of the organization, I think I've just gone over this with you. In a good summary here, the NAM will have its own financial communications office, development, membership office. It will have fellowship, perspectives, leadership consortium, innovation incubation, the Rosenthal Symposium, awards, and a whole bunch of new initiatives. Whereas the Institute of Medicine will continue pretty much remain intact, focusing mainly on the work that's been doing, whether it's self-initiated or coming through from the government in doing consensus studies, roundtables, forums, and standing committees. I'm going to stop here and see if I can answer any questions. You must have many of them. Yes, good.
Sorry, just to clarify, when you said that the IOM name is retained for a year, is it that the IOM itself is retained for a year and then moves into the National Academy of Medicine, or it still remains in place?
The name of the academy is now National Academy of Medicine, period. So we're now one of the 3 academies. The IOM is a division which does all the programs as we understand it. So function is not changed. And the reporting structure has changed. But we try to maintain reporting structure, however, through myself being chair, Clyde being ED, and so on and so forth. And the name of IOM is now along with the divisions. So there is a movement that says, why don't we all call everybody a division? And we said, no, we need to maintain the name IOM. Because when the reports come out, when you do your reports, it's going to be IOM report, right? When it's an initiative by NAM, it'll be NAM product, as you're doing right now, right? So it's a little slightly confusing, but I think we more or less try to maintain it. So what really happened is the leadership of the organization agreed that that's the way it should be, to be revisited in a year when we have more chance to see whether we still feel that we need to keep the name the way it is. Thank you. Ask.
Okay, I just have to ask, if you have a communications office, an NAM, and a finance office, now you have an office of communication, an office of, how do those interact?
Yeah. So first of all, it's not duplicating activities. It's actually creating better accountability, because every academy has its own communications office, finance office, like you have in a department, right? Or a school. And what happens is that we integrated communications of academy and programs together in IOM. And now the program communication will be IOM, and the academy communications will be academy. So it's not duplicating, it's actually getting more clarity Now, why do you need communications in NAM? Well, you just saw the list of things we're doing, and particularly communicating with members, with the public of the Academy. Why do you need IOM communications? Well, every report needs communication. As you know, we're a strong believer now that you just don't put out a report, but you need dissemination. You need to form more public awareness. We, in fact, are getting into Instagrams and you name it, right? Really trying to get the communications out. So they're slightly different. I think that NAM's communication is more public relations, communications of what we do. IOM communication is more related to its product. The report that comes out, that we put it forward, and then we continue to have the conversation on it. Okay, now finance, you can easily understand. It's a little bit like, you need to have financial accountability for the Academy, and you need to have financial accountability for the programs, which brings in a lot of money. And all we're doing is getting clarity by having two separate shops versus integrated previously into one shop. It follows much better the rest of the organization. No questions? Yes.
Some of the work you're doing right now, especially as healthcare is going digital, there's so much more overlap between engineering and natural sciences.
You got it.
That obviously fits the naming. Are there going to be some new formal collaboration structures with the Academy of Science and Academy of Engineering along with to go with the work you're doing in health business and some of those areas?
Yep, I think the starting point is, in fact, if you think about this, the staff and the boards are not changed. The starting point is the division committees change. We have engineers, we have, physical scientists, and we have health people in the same division that actually works with the IOM. So that starts the collaboration. Let me give you an example of, really good example of what's going on right now in collaboration. Many of you follow the human gene editing controversy, right? And the big area, well, I'm sure you read that National Academy of Medicine and National Academy of Sciences are taking this on together. So Ralph and I take this on together. We have staff coming together, working through the many issues about human gene editing. It's just a starting example of the future of many collaborations going forward. Now, as far as branding is concerned, so the main brand for the integration is the National Academy of Science, Engineering, Medicine. I think that we're probably going to take the CISO, which you recognize, and move it into the NAM because the divisions do not have logos per se, at least in the national academies. Okay? So I'm sorry that this is all detailed, but I just wanted to get excited about how this is really amazing, right? And you should walk around really proud because, we are making a huge difference to this country and globally. And this is what you do. On top of that, we're now going to have the ability to integrate other disciplines into our organization and still maintain the great brand of IOM. Thank you very much.
Thank you, Victor. There are several things that you said will really resonate with these folks because a strong emphasis throughout the morning's discussion and this afternoon has been the need for leadership and action and partnerships to change the current paradigms, and you've clearly emphasized that the creation of the NAM is focused on that dimension. Secondly, your emphasis on the ability to work across the various divisions within the National Academy complex is very reminiscent of what we heard here today throughout about the importance of ensuring that we're not just dealing with medicine, but we're dealing with social circumstances, with the environments in which people reside, and with the set of dynamics that make individuals vulnerable or successful across the board in dealing with their very difficult circumstances. So the short of it is, in addition to the traditional reports, which will continue, there'll be reports not of the IOM, but of the National Academies of Sciences, Engineering, and Medicine, still here, we're going to have this expanded leadership capacity and a much more cross-cutting set of activities. So thank you very much, Victor, for being with us and for your leadership. Peter, are you, yeah, why don't we just go straight on to the next panel, and if people need to take a break or get some refreshments, they're outside, so is that okay? Good.